Dr. Ross, you said, mentioned something about that this procedure was developed here, and that sounds very experimental to me, and I'm kind of concerned about being experimented on.
Sure. This is far from experimental, Kathy. This whole process of donation and transplantation is over 50 years old. The actual procedure of doing laparoscopic nephrectomies is only about 10 years old, but still, when you consider that almost 10,000 of these procedures are conducted yearly, that's a significant amount of experience.
How long will the surgery take?
You're going to be seen by a group of doctors, the anesthesiologist and the nurses. After they look over your records, they are going to take you to the operating room. The operation consists of just putting your new kidney in.
Okay.
It takes about between 2 and 3 hours. From the time that you walk to the room to the time that you get out, it takes between 3 and 4 hours.
Okay.
The procedure per se, it will take about 2 to 3 hours, depending on how it goes and depending on what kind of kidney you're getting and how difficult it is inside.
Okay, that's something that I thought of. Does it make a difference as to whether I receive a kidney from a live donor or from a cadaver?
Yes, it makes a lot of difference. Actually, the operation, the steps from 0 to the last step, they are the same.
Okay.
So the difference is that the difference in the quality of kidney that you are going to get. First of all, we don't need to remove your kidneys, okay?
Oh, okay.
So you are going to keep the 2 kidneys that you have, and you are going to receive the
An
new
extra
kidney.
one.
The new kidney that you are going to receive is going to be an extra one.
That
The
sounds
third
a little
one,
strange.
okay? So usually the way that we put in the lower part of your belly,
Okay.
kind of close to your hip.
Right.
Okay, it goes about here. The surgeon usually do a straight line or a hockey stick line.
Okay.
All right, about this size. So it goes about this long. So it's about 5 inches long.
Okay.
Okay, for us to be able to work inside and actually fit the kidney in.
The risk of problems from surgery is less than 5%, and the risk of death is less than 1%. Possible risks from surgery could include problems from being put to sleep, infection, fever, bleeding, and blood clots. Like other surgeries, you will have scars, pain, and fatigue. Every effort is made by our surgical team to reduce these risks.
What other risks do I need to be concerned about?
Well, after transplant, you might feel overwhelmed learning how to care for your kidney. You may feel upset or angry if your donated kidney isn't working well. You may also feel worried about the cost of the medications. It's important that you remain in contact with a transplant social worker to get support.
Though some people probably very scared in order to do the, kidney transplant. What if it is not last long, and what if I'm going to fail again?
I wouldn't want the donor to be, or the recipient to be afraid, because there's nothing that I'm doing this out of my own heart, and if it doesn't work, it's beyond my control, and I can only do as much as I can do, and it's something I would give no matter what.
When I got the first call for the transplant, it was like about 5 in the morning, and they told me not to eat or drink anything because there was a chance, there was a kidney and a pancreas for me, so that's what I did. They called me around 4 in the afternoon, and they asked me to come right away.
When it finally came to that time for me to get a kidney, and I thought it was the right one, I was really ready. But it was some fear, and I'm not going to tell you no lie, it was some fear.
We were admitted to the hospital the day before, which was January the 4th. The next day that I had my transplant schedule was my birthday. So that made a special birthday present for me that my son gave me.
It's the first time I was looking forward to surgery.
I remember being in the hospital. I remember she and I on gurneys going to the operating room, joking all the way, and laying in the pre-op room. We're separated by a curtain, and we're still cracking jokes with each other.
Well, the good thing that I remember, it's when the doctor woke me up, when I was the day of the surgery. For me, that's when my life changed for good. When the doctor woke me up and I asked him that when was the surgery going to start, and he told me the surgery was over.
When I first woke up after the surgery, I felt so much better. I couldn't believe it. It was instantaneous. I could tell the difference. And people had told me that, okay, when you wake up out of the surgery, if the kidney is functioning properly, you're going to feel like a new person. And I did. It was amazing. I was still in the bed. I still couldn't get up. but I felt so much better.
I definitely knew that something was going on because the level of activity had picked up greatly. So I was in intensive care, I think, most of the night, and then they got me back to a room the next day. And, obviously I knew that it hadn't worked. It was disappointing it didn't work. We were all depressed for a while. I don't think you ever completely get over something like that.
I never regretted donating. I still don't ever regret donating. Kim's would have never worked had I, or whomever would have donated the next time if we hadn't found out the first time about the serum sickness. Or Kim could have gone first, and then it would have been her. So it wasn't because it was my kidney.
Right after I had a surgeries done, I can go to the bathroom my own. It is kind of funny things, but I peed, and the smell comes to me. It was so good.
They brought me spaghetti for a dinner. I was like, what can I have to eat? And they asked me, they said, well, in fact, it wasn't spaghetti. It was muscatoli with meatballs. And I'm like, lots of sauce. And that's something you can't have when you're on dialysis if you're following the right diet. And that's what they brought me. And I had soda.
When I was in the hospital with the transplant, I told my family, I want a fruit tart. When I get home, I want to have a fruit tart with berries. And that's exactly what I had. When I came home, they had a whole, and I ate it all by myself.
How bad do you think the pain is?
You will often feel the most pain the first few days to 1 week after surgery, and we'll give you medication for any pain that you will have. Many recipients tell me that they start feeling better quickly because they have a working kidney. And then over time, in the next few weeks, pain lessens, and usually patients tell me that they're able to return to their normal activities in about a month.
At first, I was in quite a bit of pain, so I had pain pills, which helped out a lot. But after like a week, I started feeling much better. Then like a week and a half, I came back up here and they removed the drainage tube. And after that, I was like a new woman.